We're in the home stretch. I want to thank you for sticking it out with us. Couple announcements, and I left it sitting there on the table. I do want to introduce somebody to you really quickly. Cheryl, keep standing. Just wanted to point her out to you. This is Cheryl Vicerto. She's our East Coast Regional Coordinator and just newly appointed Vice President of our board. So I just wanted, yes. She's the one that gets in the face of all those East Coast doctors and said, "Why aren't you treating our kids?" So that's why, yeah, that's right. She's a great advocate, and her son has Lyme disease, severely affected, and with Lyme disease and autism, and has a great team of doctors finally on her side. And they're both here, so. Actually, you probably have more than 2 doctors. I don't know. So, where'd Dietrich go? oh, you're hiding over there. Okay, so a lot of you have been waiting because our next speaker, he's been talking about the Lyme and autism connection for years to deaf ears. And we found his articles early on in our existence where it looked like he was finding roughly around 90% and maybe even 100% of kids testing, I think, energetically and with labs for Lyme. And so he's going to share with you his input on all of that. And just a little bit about him. He is, this says well-known, I think, you know, your people typed it, but he's pretty famous for his successful treatment of heavy metal toxicity, Lyme disease, and the treatment of autism spectrum disorder. He's known as a world leader in his treatment of chronic pain and illness. He studied medicine and psychology in Freiburg, West Germany, and after graduating, he conducted 3 years of research on the dysfunction in autoimmune disorders at the Albert Ludwig, did I do it right? University in Freiburg. Dr. Klinghardt has been synthesizing traditional and alternative medicine for more than 32 years. He developed autonomic response testing, a comprehensive diagnostic system which has helped to transform many practices in the U.S. and abroad into healing centers and helped many practitioners to become accomplished healers. He currently shares his residence between the U.S. and Europe, where he holds practice and seminars in both countries. And so he's getting, we've got him for about 2 hours this morning, and hopefully we'll have time for some questions as well a little bit later. And so let's give him a warm welcome. You know how to do that? You just do the arrow.
I have to speak in this microphone. Good morning. Oh yeah. I can only.
Rock star, that's why he needs that.
No, I can only think when I can walk. I'm one of those types, like some of your children. Just briefly about how I got there. First of all, I have 58 years of experience with Asperger's, because my brother was an Asperger's, and he made it with the help of my mom. He's a psychiatrist now. He still is a little bit weird, but I sort of suffered through that, you know, being the younger brother, and understood that. I want to give you a couple of sort of clinical pearls along the way as well. That we know that the firstborn child, this is my older brother, the firstborn child gets approximately 2/3 of the body burden of toxins from the mother. There's some very good Swedish studies from the Karolinska Institute that started as early as the 60s and 70s. So if the firstborn child is the sick one, especially if it's a boy, it is likely that the toxicity component is a huge component and needs to be addressed first. If the second child is the sick one and the first one isn't, things have obviously changed. And the clinical pearl I like to give you, if the second one is the one, usually it's Lyme disease. 9 out of 10 times it's Lyme disease. And you have to focus on the treatment of the infections first. I could go now, because if you kind of really get this one, it makes the clinical diagnosis very, very easy. At the end of my talk, I like to show you that we have a new component of what is driving these illnesses, and that is the exposure to electromagnetic fields. Now, I know you've heard about this a couple of lectures or so, but I will show you a preliminary study I did on this. I'll show you some 2 simple measurements that any one of you can do at home. And if you are a pregnant mom and you sleep in an electromagnetic field of this strength, you will have an autistic child. I can today predict autism by the sleeping location of the mother. And I will show you these 2 measurements. We have one measurement that, this one, that measures the microwave from cell phone radiation and from wireless technology. And right now, if this would be a sleeping location of a pregnant mom, you would have, with absolute certainty, an autistic child. The measurement here is over 1,000, this microwatts per square meter. Everything over 1 microwatt per square meter causes biological and physiological changes in the fetus of a developing child. And things are so simple with the electrosmog thing. You don't need to have a 2-hour lecture on it, but you need to measure these things. This is not a thing you do with a dowsing rod or with a pendulum. We have very simple instrument. One costs $15, and the other one admittedly costs about $800. But with that, every practitioner should have that. And what we do now, when we have an autistic child, as much as moms allow us to do this, I send my SWAT team there and measure the sleeping location where the mother was pregnant with a child. And it is devastating what we find, that if we would have done that early on in pregnancy, the child would have turned out well. So I hope I will get there in the course of my talk here. I want to start with picking you up sort of where most of you were in the last. Okay, so this is just a little bit the curve in the rise in autism rates between 1975 and about 2000. You see this is called an exponential rise in incidence. If this curve becomes vertical, which the trend predicts here, if the curve is vertical, that means every child born is autistic. So this kind of, to give a little bit of statistical, mathematical knowledge, if this curve on the right side becomes vertical, thanks, Gary, you are a wonderful man, thank you. So if this becomes steeper, that means all children will become autistic. It's predicted that between 8 and 12 years from now, every child born is autistic if we do not change. Of course, my thesis is that autism is a consequence of an infection acquired in the womb. Autism is a congenital illness. Just very quickly, we know from the recent research that has come in that if an autistic child has a healthy brother or sister, that the healthy brother or sister really isn't healthy either. It's just a tiny bit on this side of the fence, that the precipitating event hasn't happened yet. We know that the vaccine, there's no question today in science that the vaccine is the last straw that broke the camel's back. It is not the underlying cause of it. And we know that the factors, the metabolic and epigenomic factors that are in the system that make the system so vulnerable are there before. And they are there already in the second half of the pregnancy. Something happens. We also know, just to make this absolutely sure, that there may be between 3 and 5% of children with a diagnosis of autism that do have a genetic predisposition for it. They have a tweaked gene. But we know there is no difference when we do the genomic testing, there's no difference between the healthy children and the autistic children. This only applies to 5% of the children. All the Amy Yasko stuff needs to be done on the healthy children as well. Yeah? The methylation, blah, blah, that applies to every child that's alive today, not just the autistic children. Every healthy child needs to be on B12 shots. To just correct the record on that one. The research on that is very clear, that autism starts in the womb, and then you get the second strike, and the third strike, and the fourth strike, and at some point the system gives out and changes in the way that you know it does. Here's my own little take on it. So many metabolic, anatomical, and immunologic markers suggest a viral infection. That's Jeff Bradstreet as of last week when we talked with him. I respect Jeff as wonderful in that he collects, the most data and is most up to date on the literature. I'm not that kind of a scientist. I have my nose in the practice and trying to help. I don't have my nose in the computer. This is before coming here, we scanned our records for the children that we've tested with the Western blot for Lyme disease at 72%. This is not energetic testing. This is Western blot testing that roughly 3/4 of the children test positive for Lyme disease. And this is Lyme disease clearly acquired in the womb. And I think next to Tammy, I'm one of maybe 5 people who really understands that 3/4 of these children have Lyme disease, and everything else that we're looking at are consequences of the illness, not the cause of it. I hope you can hear me on this. That when you go to a DAN meeting or Autism One or whatever meeting you go to, 95%, I'd say, of the lectures given to you are about the damage, the consequences of some unknown phenomenon. And since 5 years or so, I've been trying to preach, hey, yeah, let's look at the damage and trying to fix it, but let's look at the cause. And you know what? Whenever I lecture to a group on the causes that are pretty evident, nobody ever invites me back. It goes in one ear and out the other, and people are not getting it. And I'm suspecting that most of you here in the room need to hear this message over and over before it really sinks in. Your kids most likely have Lyme disease, and that was the cause of it. Now, is then fixing the Lyme disease not enough to get the kids well? It's the same as asking, well, you have a wildfire because a drunk teenager, put a match to the woods and put the woods on fire. Is it enough to extinguish the wildfire by finding the match and putting that out? Or finding the teenager and taking him out? Yeah, that is the real question. And of course, you know the answer to that. So yes, it's not enough to know the kid has Lyme disease and then treating the Lyme disease. It should be a component of the treatment. But in terms of preventive health care and preconception health care, there's two things that are the most important. One is to check mom if she has Lyme disease, and the other one is to check, as I will hopefully prove to you, the sleeping location of the mom. Is there anything in the house? It could be mold in the house, which is devastating to the developing fetus, and the other one is electrosmog, electromagnetic radiation. And if we can correct those 3 things, we will have healthy babies, I promise you. This one here was shocking to us, when we kind of actually examined moms. So these are all moms that claim that they're healthy. These are all moms that claim that they're healthy. 84% test positively. And this is, of course, when you test with the Western blot test, the Western blot test only shows Lyme disease if the immune system is strong and healthy enough to produce antibodies. If a kid or a mom is really sick, they're not able to produce antibodies because that's an extra thing the white blood cells do when they're feeling really well. It's like you going to work when you feel well, but if you're really sick, you stay in bed. And it's the same with the white cells. Them producing antibodies is an extra thing that they do when they feel well. And white cells infected with Lyme disease cannot produce antibodies, and therefore the Western blot test needs to be provoked in that way that you give people a treatment for a month or so and then do the test, and then it comes back positive. And so I know people like me and others here in the room have to preach this for another 10 years before this message is heard, but it's the whole underlying basis for the Leo Foundation, and I find it wonderful that Tammy grasped that. Here is a German idea, the Borna virus. Borna is a city outside Leipzig, Germany, and was discovered in the 1940s. Unfortunately, my mother was infected with it. She was in medical school and got seriously ill there after cutting herself in the anatomy lab after working on horses, and was in 1940. When was it, 1947 or so, diagnosed with the Borna virus. At the time, nobody knew how to treat it. But that's the reason my brother turned out the way he did, and also the reason I turned out the way I did. And so we started testing people for it, and were shocked that every child we tested with autism was positive for the Borna virus. There's a little bit of literature in the American literature now, but it's a virus virtually unknown. It's a virus that horse owners of race horses know very well, because once the horse gets a Borna virus infection, it can no longer race. It starts limping, it gets all the neurological symptoms that we see in autistic children. And unfortunately, there is not a single lab in the US that can do a reliable test. There's only one lab in Germany, a research lab, that does the testing reliably if you really want to know. I get back to this one a little later. Now, the gene-environment interaction is the great new word in autism. And please make me the favor, do me the favor, next time you go to a big autism conference, you know, the one with the 600-800 people in the room, everybody will mention the word gene-environment interaction and then go on and talk about the genes. Period. Yeah? They start the lecture with the gene-environment interaction, and then there is no more interaction for the rest of the 3-day meeting, but only talk about the genes and the metabolome and the biome and the proteome and all the interesting damages that are caused by it, but no talk about what about the environment. The only thing given lip service to maybe is the vaccine service issue and the mercury issue, but not many people talk about indoor mold. That is already a shrinking population of us lecturers, and then maybe 2 or 3 talk about electrosmog now, but the environment sort of is shrinking away in these lectures, because that's of course where the cause is. And of course, once a child is autistic, then fixing the environment is like finding the match that caused the fire, and it is too late. But if as a society we want to advance, and if we want to take the message that these kids are giving us, that something is going wrong, we have to go back to the environment and look at what's there. And I loved yesterday Andrea's lecture. She, by the way, I think she should get a Nobel Prize for her work, because I know that she's absolutely right in having isolated one of the major underlying environmental factors. But of course, I don't believe, since autism isn't a single illness, but is a catch-all term for a large number of illnesses, we have within that different subgroups, we have some subgroups that do not have any gut problems. There is autistic children. You can be autistic without having an inflamed gut. That's a new idea to some of you, but it's, not everybody has the inflamed gut. So there is subgroups that are behaving differently. So I'm trying to look at what are the triggering environmental factors. So the first one, of course, is the toxin ones, and it's thimerosal. Of course, we give them a lot of attention to, justifiably so. Insecticides and the Bt toxin are huge. Food preservatives and other chemicals all play a huge role. We're estimating now, it's every week the EPA grants 7 new chemicals permission to be released into the environment in the US, and the rest of the world, believe me, follows the US standard. The US has a retrospective standard. That means things are released first to be okay, and then when there's enough mounting evidence that there is damage caused by it, then the EPA or the FDA or any other government agency has the right then to withdraw it from the market. Yeah, but we first release it and then see what damage it does, and if it's too much, then we kind of stop it. That's the current policy of the current administration, and please do not re-vote the Republicans into office, because they are one of the major environmental factors of the unfolding catastrophe that we're sitting on. And they have not been responsible in their job, let's put it that way. Now, I'm not saying that the other group is going to do it a lot better. They're going to do it a tiny bit better, but anything better is better than what we've had. So, and you know, I'm a non-voting participant in this country. I'm not allowed to vote, but so I'm using my freedom of speech here. The electromagnetic fields, and please hear me on this. You've heard other lectures on it, and you probably hear more and more about it, but please differentiate between people giving lip service to it and people actually do something about it. I will show you what we do about it a little later. And then the third environmental factor is infection. And the growth curve that I showed you, as a former epidemiologist, these growth curves, you know, with the exponential growth, we've only seen with chronic infections. It's the only thing that behaves like this. When we had a TB epidemic in the early part of the last century, there's this growth, and then it flattens out, and then it dies off. With the measles, we had the same curve, and then it died off. The same curve that we saw with autism, in the beginning, it looked exactly like the curve, but it was supposed to flatten out, not to go in the other direction, and it hasn't done that. And so that means there is some other factors that have entered the picture. It doesn't look like, it looks like the first epidemic that doesn't flatten out after a while. It looks like it's on a steep rise, and none of the other epidemics ever had that steep rise where it approaches the vertical in such a strong, such a closeness in time. I hope you follow me there. What I do want to say here, the spread and increased virulence of the relatively new Lyme Borrelia strain could explain most epidemiological data and most immunological and metabolic data. Yeah, so whatever we know about autism and the changes in the immune system and in the metabolic system, all the markers that we have, every single one of these changes can be explained with congenitally acquired Lyme disease. We do not have to look at any of the other things that people look at, and most people don't look at all, they just study the damage. Yeah? Just kind of be aware of that. When you read the Dan book, every lecture in there, you know, is about the damage, the tweaks in the glutathione and the tweaks in the sulfation and the tweaks in the different aspects of the system. They're all looking at the damage. It's not looking at what's causing the damage. And I'm proposing to you, believe me, I spent the last 2 years looking at this, you know, so what do we know about these infections? What do they do in the system? The theory that Lyme is causing autism will explain every single aspect of it. Yeah? We do not have to stray very far from this. A little bit about the toxin-autism connection. One of the best publications is from my friend Joachim Mutter. He's in my hometown, the head of environmental medicine. He published a paper, you know, Mercury and Autism, Accelerating Evidence. And then Isaac Pessa is, where is he? He's at Davis in California, and works really with a lot of government grants and has published some of the best studies. I just met him last week, but he looked at the thimerosal issue and showed that very significant changes in the cell and cell wall and transcription of the genes are caused by thimerosal that we are finding in the autistic children. But he also looked at PCB and find very, very similar changes in the rat that have to do with the speech, basically, with the auditory component of speech. You know, when in order to speak, the child needs to hear. And if the child hears garble, it cannot learn to speak. And in the rat, basically, it has been shown that the exposure to PCB will cause those exact changes that we see in the children, in the more severely affected children. I'd like to look at this concept, which of course is no stranger to you, that we're assuming that what ultimately, let's start from another point of view. The human species has evolved over the last 1.8 billion years, from the beginning of the eukaryotes, the higher evolved microorganisms, to the human species is 1.8 billion years. And we are the sturdiest, toughest species on the planet. It's not the shark. Yeah? The humans are the toughest species, and it takes a lot of insult to destroy a child. We've reached that. You know, we've maxed out on what we can do to a child's brain, obviously, and I'm holding, like together with many of you, the idea that there's probably a synergistic effect between the different single factors that we've looked at. The Pt toxin, plus invading microbes, plus a change in the secondary damages that are occurring and so forth. And so here's a little bit from the literature. If you give an LD1 to a group of rats, so that LD1 means lethal doses, 1%, that amount of lead will kill 1 out of 100 rats. And if you determine what the lethal doses is for mercury for an LD1, so when you add both of them and feed both of them to the same group of rats, one would assume in a naive kind of thinking brain that now 2% of the rats die, but in fact it's 100%. So in toxicology, 1 + 1 = 100. And researchers have tried to do predictive computer models of taking all the environmental toxins that have been found in us and try to create models for the synergistic effects. And up to date, it cannot be done. The mathematics for that do not exist yet to calculate that. But it is estimated there's over 120,000 chemicals that are released in our environment that are persistent in it. And every study ever looked at it, you know, the body burden study that's in EWG, Environmental Working Group, published there, showed that out of 400 chemical studies, you know, the average person had like 260 in significant amounts, meaning in amounts that predict damaging effects. So how do you study the synergistic effect between 260 things? We can do it with 2 things so far. The mathematical models are there, but we cannot do it with 260 things. And so what I'm proposing, along with most other researchers, is that the outcome, the damage, or the proportions of damage that we've reached are the synergistic effect between all these different things. Meaning, it is not enough to give somebody DMPS shots or DMSA to pull the mercury out. You also need to have something that addresses the PCBs and the PBDEs and all the other environmental substances that are in our kids. And added to that is the biotoxins that are created. I will expand on that a little bit, but when you have Lyme disease or mold in the system, all these bugs maintain themselves in the system. They have to create toxic substances that shield themselves from the immune system. And that adds to the body burden of the chemicals that we already have on board. And so in order to treat that, we have to use antimicrobial substances to stop that. And so the dance really, as you know, in the treatment of autism, in terms of the environmental factors, is really 3 things. We have to stop the microbes growing in us. That's number 1. In toxicology, Rule number one is remove the person from the source of the toxin. Yeah? Remove the person from the exposure. And if the exposure is an ongoing inner exposure with molds and Lyme spirochetes creating biotoxins every day, it is insane to start giving people glutathione and other things, trying to fix the damage downstream that these bugs are causing. You want to stop the bugs from growing. That's rule number one. And rule number two is then, yes, then do the things that get the toxins out of the system. Yeah? And then rule number three is that the electrosmog, as I will hopefully show you, is a huge component that drives the growth of the microbes. And so you have to get the person out of the field that is supporting the microbes. And when you've done those things, then you're, in my opinion, then you're allowed to fix the damage. I want to put one thing here. Gary Gordon is here, and you can hear me on that. And there's probably a few other people here. There is a conflict of interests between fixing the damage on one end and treating the causes on this end. And I'll tell you why. In order to, the mechanism that our body is using to treat the microbes that are active in us, the mechanism is all oxidative. It's all about oxidating the hell out of the bugs. Yeah? With the release of oxidative substances that the white cells create in order to kill the bugs. And there is a lot of research in Germany that I'm aware of. I haven't seen a single paper on this here that shows that the first thing when you give a person glutathione is that the bugs in you are grabbing the glutathione and shield themselves against the oxidative damage from the bugs. And so by treating the damage, you're actually perpetuating the injury. I give you this as a big idea, not that I will give you a total solution to it. I'll give you part of the solution to this. But the first phase of the treatment, and this is sort of my thesis here, the first phase of the treatment has to be to support oxidative mechanisms in the body so you can get rid of the bugs. And then has to be the healing phase where you do the antioxidative stuff to repair the system. And unfortunately, to detox, also you need a lot of antioxidative stuff like DMPS, DMSA, they're all antioxidants. And so in order to do this right, you start with the killing spree. It has to be that way. If you have like one person after another going, you know, with their lighter fluids and putting fire to the forest while you're trying to extinguish it on the other end, that makes no sense. You have to first stop what's causing the fire. And unfortunately, these are all oxidative mechanisms. And one of the main things I found in the last year is many of our natural approaches to killing the bugs are beautifully and working. But the moment the patient takes behind my back or the load of vitamin C, alpha-lipoic acid, glutathione or so, it no longer works. And the main reason we see this thing where our Lyme patients, our adult Lyme patients are for years and years on antibiotics, is that at the same time they're taking all the antioxidants that the bugs are using to protect themselves. It is at this point a thesis, it's a theory that has a lot of support in the literature. But I want to put this out to you guys, that you cannot, when you treat these illnesses, you cannot do everything at the same time. By trying to do an oxidative burst to get rid of the bugs, and at the same time protecting the bugs with antioxidants, you will not succeed, and that's sort of what we see. And when you separate those things out, suddenly you see things that you didn't see, miracles that you didn't see before. So I just wanted to put that at the beginning here. This is an important finding. Toxic body compartments cannot be controlled by the cells of the immune system and become the breeding place for microbes. The higher the toxic burden, the higher the microbial burden. Let me explain that. When you have an area in the body where the body has compartmentalized mercury, that's a proper toxicological term. Yeah? If you compartmentalize mercury, it's not everywhere in the same amount distributed in the body, as in certain body compartment is more than in others. And wherever the body has compartmentalized toxic substances, the immune system withdraws from this area. because the white blood cells are very vulnerable. They're beautiful, alive beings in us that are here to help us. Yet they have their own little consciousness and awareness. They're fully alive little beings that happen to carry the same DNA as we do, so they're related to us, but they're not us. And they're wonderful in what they do, but they cannot handle mercury. They cannot handle aluminum deposits. They cannot handle cadmium deposits. Why? Because we have evolved over 1.8 billion years, and we started digging up the earth and putting all this dirt in the food chain only in the last 150 years. That was not enough for us to mutate and for us to keep up evolutionary with the toxic onslaught. Gary has shown us a statistic a few years ago that when you check the content of lead in our long bones, it's now 400 to 1,000 times more than it was 400 years ago. In 400 years, 1,000 times more of a particular toxin. There is no way that our genetic code can accommodate for that. We are incredibly adaptive, but not that much. And so, wherever we are contaminated inside ourselves, the immune system cannot be active. And these are the breeding places for the bugs. This is where the viruses grow, where mycoplasma lives, and other things live. And of course, the new term that we're using is that these hiding places in the body are all even more compartmentalized. That within those areas, it's the biofilm. It's these little kind of layers of a gel-like mass that coats the fascia. In the fibromyalgia patient, coats the fascia of the muscles. In the joints, you know, the Lyme patient that have joint problems, it's the joint membranes that has this layer of biofilm on it. Biofilms are the hiding places of the bugs, and they create a gel-like mass that's full of bactericidins, fungocidins, that's full of the substances that the bugs need to defend themselves against the immune system. And they do that very successfully so. And so by using a good biofilm protocol, we can punch holes into that and start the process of getting at the bugs. And this is a big issue. So toxins can lead to mutations and polymorphisms on the genome level. They inhibit the enzymes responsible for elimination in many aspects of the metabolome and lead to a vicious cycle of entrapment of more toxins and growth of more pathogenic microbes. Basically, this is sort of, if you go to a DAN meeting, there's going to be 90% of your lectures are going to be about the damage that mercury or other toxins have caused to the enzymes responsible to elimination. Yeah, the main guy mentioned in almost every lecture is the glutathione S transferase. Yeah, it's one of the enzymes damaged by mercury, but not only by mercury, but also by many of the mold toxins that are known, but also created by many of the spirochetal toxins. Now the big one for me is electromagnetic radiation. And here is from the literature, drives the growth of microbes. Molds increase their growth rate and put out far more virulent mycotoxins under the influence of electrosmog. I tell you what we did with this, a very, very simple experiment. We grew several generations of mold. These are friends of mine in Germany that play with these things with me, and every time I come there, we go in a lab and mess around with it. But we basically created the offspring of molds under a Faraday cage. We simply created a Faraday cage that shields out all the electromagnetic radiation from cell phones, from ambient fields in the lab, and grew several generations of mold. And then we took a bacterial culture of strep, staph, and other things that we had available, you know, where you have a nice agar-agar plate that is full of this microbial growth. And then with a pipette, we put a little bit of mold in there. And the mold then protects itself by putting out some mold toxins and creates a little margin around the mold of clear agar-agar where the bacteria withdraws from it. When we had exposed the mold for 2 generations to electrosmog, that means without the Faraday cage, and we do the same experiment, the margin that the mold creates around itself is 600 times larger than the margin of the mold not grown under electrosmog. I translate that for what that means for you. if you are a person that lives out in the country where there's no cell phone reception and you have no electricity in the house and you have Lyme disease, you will not have any symptoms. The moment you move in the city environment or village environment or in the country where you have those things, the microbes believe now that they are attacked by the radiation penetrating your body, and they will put out a 600 times more virulent mycotoxin than they did before. And you, of course, get sick now from that. This is not that you have a new infection, it is that the old infection in you, the symbiotic bugs that live with you probably for centuries or for thousands of years, are now feel under attack, and they are fighting back. They're simply doing what you also would do. And so I will show you the evidence of that a little later. Important is that you know the infants do not have a blood-brain barrier. The blood-brain barrier completes itself about at age 18 months of age. They are completely vulnerable. The kids in the womb and for the first year and a half are everything that's in the air, everything that's in your food, everything that's in the water, everything that is transferred through the placenta into the baby will enter the central nervous system of the baby. The central nervous system has the poorest immune system in the body. Once something is across the barrier, it is in, and there's very, very little defenses there. And unfortunately, it's the astrocytes and the microglia take the first hit that's just beyond the blood-brain barrier. And so if there is a transfer, and this brings it back to the mercury issue, that we find that the first injury to the brain with mercury is the astrocytes. And the astrocytes are the cells in charge of making the blood-brain barrier. The blood-brain barrier are little feet that the astrocytes have that they wrap around the blood vessels. And they're intelligent sensors, so whenever there's something toxic coming in the blood, they don't open up. If the blood is clean, there's nutrients in it, it opens up, it takes its foot away, and the nutrients come in. The first injury that mercury does in the body, in the infant or in the fetus in the womb, is the astrocytes. And when the astrocytes are damaged, you will never develop a healthy blood-brain barrier. Yeah? That means these kids have the equivalent of a leaky gut in the brain. We know that the leaky gut responds, by the way, to the same mechanism, that the first thing injured in the gut is the barrier mechanism. And so our autistic children can never develop a healthy blood-brain barrier. It means that it's constantly leaky, and whatever infections they have in the gut and other parts of the body will leak into the brain. Yeah? So I think that's an important piece of science that's important. Now, yeah, I call it my Trojan horse theory. Mercury is the stealthy door opener. It is installed into the brain via the vaccines before the blood-brain barrier had any control. Yeah, so just that at least in the time when we had the mercury-containing vaccines, now it's aluminum and other toxic substances that we've replaced the devil with the brother of the devil, telling them that there's no problem now. I think Boyd Haley did enough studies now to show the synergistic effect between the modern adjuvants that are used in the vaccines, that they're near as damaging as the old mercury was. And so by giving a child vaccines shortly after birth, we're clearly damaging the astrocytes, and whatever chance the child had to form a blood-brain barrier is forever lost, or is lost until we start detoxing the kid. And the wonderful thing about the leaky blood-brain barrier is that that DMPS and DMSA and all the substances that we're using for detoxing never ever cross the blood-brain barrier. They don't work in the brain unless the blood-brain barrier is damaged. So actually the effect of the main detox agent that we use depends on having a damaged blood-brain barrier. I hope you follow me on that one. Yeah? D-penicillamine is the only substance that has ever been shown to actually cross the healthy blood-brain barrier. So it's something that I use late in the detox, is D-penicillamine, because once you actually fix the blood-brain barrier, you can no longer get the residual toxins out of the brain. You have to use something that crosses the blood-brain barrier. It's cilantro and D-penicillamine are the only things that have been shown to do this. I don't have to go over these. So when you see like a map like this, just kind of know that you're talking to another physician or lecturer who looks at the damage, yeah? Who does not look at the causes. Are we all clear on that? Yeah? This is a picture of the damage. And little sort of lip service given to the environment. Now, the diet things, this is already all outcome of the damage. I mean, we know that it's not the diet causing the damage, it's the vulnerability to the dietary ingredients is a consequence of the damage, not the cause of it. Doesn't mean we don't have to do it. And then here's another one. If you look at at a map like this, it's again looking at the damage. It is not really looking at the causes of it. Statistics that I like. This is the parental assessment. This is from Tapan Ajia from Vitamin Diagnostics. Looking at the success in treatment of children with autism on the different interventions. So if you give P5P, near half of them responded with some improvement. 36% responded to lifting up the sulfate levels, and 68% by correcting the fatty acids. I know, and remember, when you see this in the future, these are all things that look at the damage. It's not looking at the cause of it. These kids, the cause of their autism is not a B6 deficiency. If we're using B6 to fix something that we don't really know what it is, we think it's something in the methylation pathways, but we don't really know. When we look at this, again, when the sulfate levels are much lower in autistic kids, glutathione levels are lower in autistic kids, we're looking at the damage here, we're not looking at the cause. Yeah? These kids, the reason they're sick is not that they have low glutathione levels. They have something else that's causing the low glutathione levels. That's blocking the enzymes from making it. It doesn't mean you shouldn't fix that. Here is one of the explanations why the sulfur levels are low in the kids. The more organophosphates are in the system, the lower the plasma levels of sulfate. Yeah? So sulfate gets used up, or the mechanisms that we have to make enough functional sulfur molecules in the body, that mechanism gets blocked by the presence of organophosphates. Here is the, by some of you loved, by many of you feared methylation pathways. I'm not going to go into that. I personally, I use the few things that have come out of the methylation thinking, the B12 shots and the folinic acid, and there's only a few things, SAMe, D-L-methionine. There's like maybe at most 10 things that you need to consider to give people to fix the methylation issues. And I think it's overrated. Personally, I hold that here, it's overrated. But it's currently our consensus reality that we talk about the methylation cycle, and we spend whole 3-day meetings on it, discussing whether Amy Yasko is right or not, or Richard Deeth is right or not. It certainly is it's a huge piece of the damage piece. This is looking at the damage. Yeah, where is the damage? But believe me, it says 20,000 biochemical reactions that we know so far. Many we don't know yet, and picking out 10 or 20 of them and kind of saying this is the core piece. I don't know if you can think that way. When you look at that big biochemical chart, and you think that each chemical reaction would be a cogwheel and they're all interlocked with each other. When you tweak one thing, one step here, you're affecting the entire chart. And so we don't really know yet. With mercury, we know for sure that there's never been any of the 20,000 or so metabolic enzymes. There's never been shown one single enzyme that is not damaged by low levels of mercury. Yeah? So I'm just putting that in the air here. Here's a couple of new ideas that often work beautiful. I just want to give you this at the beginning to show you where me and a few other people are sort of experimenting right now. And so the first one is L-DOPA in low doses. That's from Dr. Segawa in Japan. I've met him for the first time a week ago, but I've been using his L-DOPA treatment for about 2 years. It works beautiful in many of the autistic kids, especially if speech is delayed. It's 0.5 milligrams per kilogram per day. That's a very, very low dose of L-DOPA that the researchers assure us is not causing any of the typical problems with L-DOPA that we see in grown-ups when we give them a typical doses for Parkinson's. These are subclinical doses that have a beautiful effect, and you can try that out on your kid because you see the effect within a week. Yeah, that the motor function improves, the speech improves. If they had speech at all before, often the speech comes in that week, and it's a wonderful, simple intervention. Be aware that L-DOPA is not in the PDR. We have carbidopa in the US, and L-DOPA has to be compounded by compounding pharmacists. So you can do the dose calculation. I like to give it in 4 divided doses. That means tiny amounts 4 times a day. The next big one is lithium. The same lithium that's used for bipolar disorder. There's the original article that came out, and it was a few months ago. The second paper came out. Those of you here who are MDs, for the treatment of ALS. Yeah, ALS is probably the most devastating neurological disorder in grown-ups, where I went to the graveyard more often on my ALS patient than with any other patient group. You know, I'd much rather see 10 cancer patients than one ALS patient. Anyway, so it's friends of mine in Italy, Professor Rogeri from Roma. They have a miserable soccer team, by the way. Anyway, he did a study. He tried to do a study on Parkinson's because we found that lithium works great on Parkinson's. And remember, Parkinson's is related to autism, and that the dopaminergic pathways are disturbed. And so we wanted him to do a study on grown-ups with Parkinson's on lithium. It works great, by the way. And then he included, by accident, 3 ALS patients that also had Parkinson's symptoms. And after a few weeks, it became clear that these ALS patients had unusual improvements. So he changed the study to ALS and published it at PNAS, that's the Journal of the Academy of Sciences, one of the highest ranked medical journals, just a few months ago, with incredible success rate in giving lithium carbonate at a certain dosage to ALS patients. This is a big, big breakthrough in neurology. And so with that, I started treating the first autistic kids in Germany with it, which looks fantastic right now. Lithium protects the nerves from the neurotoxins and biotoxins in the body. Again, it's damage management. But in the ALS group, we could find there's true repair going on in the central nervous system that we've never seen before, never thought possible before. And so the blood level that we're shooting for is 4. And, sorry, this is a mistake, is 0.4, a big mistake. Yeah, so it's 0.4. And the average dose, you can calculate average dose for a grown-up, full dose for grown-up is 300 milligrams lithium carbonate a day. So for these kids is somewhere in the neighborhood of 75 or so, depending on how old they are. And you want to start with half of that for a couple of weeks. It takes a while before the blood levels to stabilize. But do read the study first at PNAS. Then the big one is the coronavirus. And I give you sort of like some information on it. First of all, here is the original biggest study on it so far. There was a meeting in Germany 2 years ago by the leading psychiatrist in the country, and the title of the conference was, "Are all psychiatric diseases chronic infections of the brain?" Are all psychiatric diseases chronic infections of the brain? That was the title. And the resounding result of the seminar after 4 days was yes, absolutely yes. And bipolar disorder clearly is linked to the coronavirus. Yeah, there is absolute certain statistics on that, that when you do a PCR test on the coronavirus at the height of a manic episode, the level of the coronavirus in the patient is extremely high. If you do it at the depth of the depression, it is low. Yeah? So the coronavirus, as it oscillates in the system, so do the symptoms. And like I said, 6 out of 6 autistic children that I tested so far for it were positive for it. And the interesting thing is, then I looked at the literature. Okay, how are the Germans fixing it? They use methyl B12, they use P5P, they use folinic acid, SAMe, and creatine. This is how they're treating the coronavirus. Now, does it remind you of something? I mean, you know, so what I'm trying to propose here is that when you have a kid who responds to the Neubrander protocol of injecting B12, it doesn't mean that you fix the methylation cycle. It could easily be that you are treating a coronavirus infection successfully. And amantadine, by the way, is the wonderful drug that has pulled a lot of my adult patients out of bipolar disorder, because it's suggested for the coronavirus. Amantadine is rough. It's rough in autistic children for the first couple of months. It doesn't like a lot of company with other drugs. It's difficult to give it together with Valtrex. Yeah, like some of your kids are on that. So there's a competition and mutual inhibition of the different drugs. Microbes communicate with each other. A thesis that's emerged in the field, Lyme intelligently incorporates genes from other microbes, Mycoplasma, herpes viruses, and mold, and gains their survival mechanisms and their vulnerability. So I like to remind you of a piece of truth here. When you have an ELISA test or a Western blot test or a PCR test, and it shows reactivity against a certain microbe, it does not necessarily mean that you have that microbe. It means that you have a microbe that has enough similarity with the microbe that is named in the outcome of the test. Let me explain it for the PCR test. If you take the genome, let's say of Borrelia, it is about the length of the pages of the Bible. You know, if you take all the genes together, all the letters of the genes together, it's about the length of a Bible. What you are actually testing in the PCR test is one sentence out of that book. And if that one sentence is found, then we say you have that bug. But what is not acknowledged is that molds are masters. Yeah, at the recent meeting it was compared, if you look at the evolutionary scale of a bacteria and of mold, bacteria is like a cabbage and mold is like an elephant. It's highly, highly intelligent and sophisticated, and much closer to us humans than to bacteria. Spirochetes are somewhere in the middle between the two. They're the most evolved, sophisticated amongst the bacteria. And what spirochetes have learned is to grab, via the plasmids, DNA pieces of herpes viruses, of mycoplasma, of mold, to incorporate into their system so they learn how to survive in a hostile environment like our body. And the wonderful thing that comes with that makes the bugs also vulnerable to the interventions. And I talked to Sid Baker last week. You know, I said, Sid, if you only would do one intervention on the Lyme kids, what would you give them? And he said very clearly, it's the antifungals. Do you believe that you treat fungal infections? He said, I still don't know. Now, we know that antifungals have a huge effect on Lyme disease. There's a German study that shows that you can treat Lyme disease just by giving people diflucan. You can successfully eradicate Lyme from the body just with diflucan. Now, I tried this. It works beautiful in Germany. It doesn't work here. In Germany, the strain of Lyme that we have is Borrelia afzelii, and it's not Borrelia burgdorferi, which is the strain we have predominantly here. However, it shows the principle that the vicious strain of Lyme that we have in the US definitely contains parts of the genome of the herpes viruses and parts of the genome of mold. And therefore, giving Valtrex and giving diflucan or Sporanox, itraconazole, have been important details of the treatment, but have misled many of you to believe that your kid actually has a significant number of herpes viruses active in the system, or has a significant amount of mold in the system, which may or may not be true. But when you treat Lyme disease, and all of us old Lyme doctors know that, I've been doing Lyme now for, I don't know, 15 years or so, longer than most of the people that I know. And we know one of the primary things that we recognized early on, when we just give antibiotics to the Lyme patients, we may or may not make some progress. But once we add the antifungals and the antivirals, we really make progress. And it has to do with this mechanism. Okay, so to treat Lyme in children successfully, we have to use anti-mold strategies. And I use three things. These are, I don't use, to a large degree, I don't use medical drugs for various reasons. But I'm also not naive with it. I look at my lab work and I look at what I find. My main strategies beyond of what you guys are used to is MMS. You know, MMS is acidified sodium chloride. It's marketed under the name Miracle Mineral Solution, and please read that up in case you haven't yet. And many people think it's a hoax. It's been used in veterinary medicine for over 50 years, very, very successfully. And the way I use it in the Lyme autistic children is not the way it is advertised in the book. MMS is a form of bleach, basically, that you react with an acid, and then it creates a splits of chlorine dioxide, which is a potent oxidizing antimicrobial agent that definitely works, but it has an awful smell, and children don't like it, and grown-ups don't like it. And so my friend, the Professor Scheidel in Germany, who's one of the leading chemists, said they've been treating horses with it for over 50 years, and they don't react it. They just use a straight sodium chloride solution, which is absolutely tasteless, has no taste, no smell whatsoever. And what it does, by drinking that, in areas where the body is acidic, it converts itself to the chlorine dioxide and splits it off just in the areas where you're acidic, which happen to be the areas where your body is contaminated with toxic metals and where the microbes live. So it's by actually not reacting it, it's a fantastic delivery system of chlorine dioxide to exactly the areas where your body is toxic. And so the average dose for like a 3-year-old child is 2 drops a day, and it has to be mixed, has to be expanded into at least a quart of water. That means basically you mix it in the morning, you put 2 drops in a quart of water, and all the drinks and food, whatever you give the child, you try to use that water to get the quart of this mix into the child. And they will quickly go into the Herxheimer reactions. They're in the areas where the bugs are, and they go through the Herxheimer reactions and come out much better on the other end. Yeah? So it's a wonderful new way of treating. The other one I will get into that are the rhizoles. Rhizoles are 50% ozonated castor oil and 50% ozonated other plant oils. There's 10 of them. And again, the same professor has shown by ozonating castor oil, this is done for several weeks, castor oil is ozonated, a new class of compounds is created. They're called rhizoles. They're highly, highly antimicrobial, antifungal, antibacterial, antiviral substances like we've never seen on the planet before. This was the leading antibiotic treatment in Europe from 1915 to 1947, And then under pressure by the occupying forces, as we call them, we had to give that up, but has re-emerged now and are fantastic treatments for all the things that we see in the kids. And so there is, I get a little deeper into that. The propolis vaporizer is a strategy to make the house mold-free. Italian study shows when you vaporize propolis at 82.3 degrees Celsius, it creates a monoatomic vapor of propolis in the house that kills every single living microbe in the air. And it's a way of making homes that are not safe for the children safe. And it's a fantastic tool. It's inexpensive, like $150 or so. It's $3 a week for the little cartridge with the propolis in it. And it has transformed the lives of a lot of these kids. Italian asthma study shows over 70% asthma cures in 6 weeks with kids. 70% asthma cures at $3 a week. There's not much that matches that. So that's the first strategy, is the anti-mold strategies. I do it with these things. You do it with fluconazole, itraconazole. Then the antiviral strategies, you can use Valtrex. Valtrex is a good drug. I don't like Valcide in the children. It's a newer drug. Has too much side effects in the kids. Again, MMS, very good for the viruses. Rhizole zeta, that's my secret weapon against the herpes viruses and against the Borna virus and the flu viruses and the several others. However, Bradstreet reminded me last week that by actually changing the redox status by using DMPS and DMSA, that these are actually very strong antiviral strategies. My favorite that we use is called the Vacuum Singlet Oxygen Energy. It's an instrument that's out on the table, BioTools. That's a Swedish intervention. It's a certain biochemical physical process by which you charge water molecules with what's called singlet oxygen energy, and that is given off. You can inhale it or you can drink it. It's a fantastic antiviral that is absolutely astounding how well it works. Then we get to this one here. The large reservoir of spirochetes resides in the gut. That is forgotten. It's in the literature, but it's forgotten that over 90% of the actual body burden of the spirochetes is in the poop. It's not in your tissues. And it interacts with the gut-associated lymphatic tissue, completely changes your immune system. And my favorite drug from a medical point of view is Alinea. If you not have used Alinea on your children, please do. Alinea is the miracle drug for the gut. It treats H. pylori, it treats all the worms, the Ascaris and the strongyloides and the tapeworms. It treats Giardia and amoebas. It treats, and this is the most important, it treats all the Clostridia. You get rid of all the Clostridia. The grown-up dose for the treatment, then you can calculate from there, is 1,000 milligrams twice a day for 20 days. Yeah, and you make your decisions from there. It's an absolutely astounding, fantastic drug. And I use, my preferred treatment is the Rhizole Gamma, which is designed to eliminate all the intestinal parasites of various sorts. It works beautiful, a little slower, a little bit more gentle, but also gets you there. This is just a little bit on the mold. Let me just kind of highlight a few things. Exposure to high levels of indoor mold can cause, and here comes the injury to all the systems that we see in autistic children, in immunocompetent humans. This is new in this article. You don't have to have an damaged immune system to be sensitive to mold. And if you as a mom were pregnant in a moldy home, like most of you were, your child didn't have a blood-brain barrier to protect itself from the mycotoxins that the mold releases into the air, your child got damaged by it. We had the biggest court case here in California about a year ago where the mother was awarded $30 million, autistic child caused by indoor mold. So, and when you know with a $150 instrument, you can conquer this problem, you have to know about that. Okay, this is just the intestinal barrier is altered by one of many of the mycotoxins. And look here, protective effects of glutathione. You know, when we give glutathione, the kids get better. It does not mean diddly-doop about that you're detoxing mercury or that you're doing anything else, that you're fixing something in the methylation, blah, blah, blah. It most likely simply means that you're doing something about the mycotoxins in the gut. You're changing the gut barrier function. You're re-establishing a little bit more protective barrier in the gut. Yesterday I was very impressed with the BT lecture from Andrea, and I get into that, how we're dealing with that. And here's the other one. Alpha-lipoic acid as a potential first agent for protection from mycotoxins. I'm just giving you some new ideas here. Yeah? When you give alpha-lipoic acid and glutathione, it doesn't mean that you're fixing something in the genome and all that. You're probably just treating mold and the damage of mold. But if you're treating the damage, why not look at the cause of it and get rid of the mold altogether? Any one of you who has an autistic kid who didn't do mold testing in the house, you're missing the boat. It's one of the biggest, hugest environmental factors. And that mold copulates with the Lyme disease that's already in your kid and creates a superbug that you will never get rid of. So these are huge issues. That's a little bit on what I do in my Lyme treatment protocol. So there is 3 components, and let me go over that, and then I get back to what I really wanted to lecture about. I do that in the last half hour. But when you treat Lyme disease, and this is true for all chronic infections, there is 3 distinctive components to the treatment. The first one is you have to kill the bugs. The second one, you have to get rid of the biotoxins that the bugs are creating in you. When you attack a bug with an insufficient medication, the bug will fight back with the output of more biotoxins and more reproductive growth. That we know for sure from the literature. And if we are attacking Lyme spirochetes with an antibiotic that can never fully cover the spectrum of the Lyme, the bugs will shoot back with their particular biotoxin. That's what we call the Herxheimer reaction. The Herxheimer reaction is, in my opinion, not a die-off effect, but it is, we're making the bugs angry effect. And by covering a wider spectrum, by addressing the cell membrane components that are more similar to mold, by giving anti-mold strategies, and addressing the cell wall components or the defensive mechanism that I've learned from viruses, by addressing it at the same time, we have a much better chance of keeping the Herxheimer reactions mild. So the second strategy is get rid of the mycotoxins and biotoxins from Lyme and all that. And let me say this right away here, DMPS, DMSA, EDTA are all wonderful agents to remove the biotoxins of these bugs. And it is one of the gravest mistakes that has happened in our field, that moms are constantly looking at the mercury level in the hair or in the poop or in the urine. The illness at this point of your kids has nothing to do with the mercury that's still in there. This is a pool of toxins in there, and you need to get in there with the rotor-rooter, with a system that gets out many of these. There's some German studies that shows that both calcium and sodium EDTA are great in removing many of the specific Lyme neurotoxins from the body. There's many studies that show that many of the environmental toxins and mold toxins are removed with DMPS and DMSA. And so if you want to use stool testing or urine testing, monitor the biotoxins in the urine, which there is no test for, other than bioenergetic testing. And so it is a grave mistake that has happened in our field when people think there's no more, in the whatever Laboratoire Auguste in Paris, when there's no more precoproporphyrin in the pee, or there's no more this and that in the poop or the pee, that you're finished. That's when you're beginning. When the metals are down, that's when your chelators start to grab some of the biotoxins that are really making your kids sick. So please keep that in mind. Look at the response of your kid to these things. Don't look at the lab work. Look at the child. And I'm known for. I was the person who did the most lab work 20 years ago on heavy metals and all that. I hardly ever use it now because it's the wrong place to look. It's not where the gold is at. Okay, so we do a few rhizoles and we use freeze-dried garlic. Allicin has been shown to be very effective against Borrelia. Allicin is released when garlic is chewed or when it's broken down. It has a short half-life of 10 days. That means most garlic products do not contain any allicin because it's long been converted to other compounds. And so freeze-dried garlic and stabilized allicin are the only two compounds that do this. I prefer freeze-dried garlic because the many sulfur compounds in garlics detoxify mercury and many other toxins. Then I use the MMS. And then, whoops. Okay, I don't know why I can't get this one. But I also use bee venom therapy. And interesting, yesterday in Andrea's lecture, I remember that the neuropeptide that she talked about, the what was the name? Octosamine, yeah, octosamine, is contained in bee venom in very, very high amounts. And I tend to treat autistic kids, especially when they have clearly marked neurological symptoms like hypotonia or like a weird gait. I treat them with bee venom injections since 20 years with wonderful results. I mix it with Procaine to make it a fairly painless procedure. Needs to be done every other day. It's a fantastic, fantastic treatment. And you can also use oral bee venom. It exists in a form stabilized with honey. Interesting, bee venom is very unstable, but when you mix it with honey, it becomes very stable. And it's a wonderful treatment for the autistic kids. You can look that up on my website on how to do that right. What's a rhizole? Rhizoles are ozonated plant oils. I just read that first chapter here. The ozonides transfer oxygen and change the environment in which anaerobic pathogenic germs live, making it a more aerobic environment. Works fantastic for Clostridia. The ozonated oils are surface active, and with its active substances moistens the intestinal mucous membrane where nests of fungi and bacteria and parasites might be located. This is from the original German writing from 50 years ago. We know now that the rhizoles also penetrate in the cell, are very, very highly active for intracellular pathogens like chlamydia, the intracellular forms of Lyme disease, and so forth. Okay, so what do we do to remove biotoxin biofilm? The first paragraph here is the most important. The biofilm in the gut is this I think Lee Cowden calls it the false lining of the gut. We looked for years what works best, and I'm using clay. It's a half to 1 teaspoon twice a day for 4 to 6 weeks. I talked yesterday with Andrea. Andrea told me that she turned me onto this idea 3 or 4 years ago. I totally forgotten about it and thought it was my own idea. But Andrea has the best clays for this purpose. The clay, what's the one that's in the health food stores here? The common one, bentonite. Yeah? Bentonite is a patented form of clay that is the most miserable of all of them. It doesn't work very well. There's much better clays, and please go to Andrea's website. I'm sure she's got it on there. Is Andrea here? Yeah. Do you have that on your website? Can people find your clay there? Okay. Her website is reversingautism.com, I think, or .org? .org, okay. So this is not a small piece. You know, the clay, I believe, is also removing the Bt toxin from the gut, is extracting it out of it. You suffocate the bugs that live on the inner lining of the gut. It's amazingly, amazingly effective in getting very rapid results with the children in terms of overall neurological improvements. At a cost, I import clay from England because I didn't know about yours. I will certainly change that when we found that the bentonite really didn't do much, and it's a more coarse clay, and it's wonderful. It takes about 4 weeks to see really dramatic changes. I do chase it with either a non-psyllium fiber product or large doses of chlorella. Be aware that psyllium contains 5% gluten. Yeah, so some moms have made the mistake of using, to create better bowel movements, to use psyllium husks. And it's an absolute no-no with autistic kids. Yeah? So you use other fiber products, none of which work as well as the psyllium, yeah? But they don't contain gluten. Then I followed that with Dr. Usman's biofilm protocol, which is really addressing the biofilms that are in the muscles and beyond the gut in the rest of the body. Now, my big contribution to the field really was this one that's been completely underappreciated in this country. In Switzerland, one of the autistic moms whose kids I treated published a book on the use of chlorella. She uses between 80 and 120 tablets chlorella on each child and has an 86% cure rate just with one single intervention. Let me give you a little bit what's in chlorella. Chlorella has a membrane that absorbs most environmental toxins. There's a study on virtually every environmental toxin group that we know. Dioxin, PCB, PCP, PBDEs, mercury, lead, arsenic, and so forth. I could go down the whole list. But the inner ingredients of chlorella, it is the only plant that has a high level of methyl B12 in it, in a stabilized form. It has the amino acid profile that is virtually identical to breast milk. It is 50%, over 50% of the chlorella weight is amino acids. And so there's two types of chlorella. One is called chlorella vulgaris, the other one is called chlorella purinaedosa. Vulgaris is easier to crack open and to digest for its nutrients. The purinaedosa is better for binding toxins. I have a few studies here. I did a study with the university in Germany where we showed when we put chlorella in this and what comes out is loaded with mercury and lead and arsenic and so forth. There is a particular biochemist in the US who kind of has a grudge with me, who kind of tried to repeat the study and showed with his lab that there was nothing coming out, and he was using a very infantile version of the stool test that couldn't show mercury because mercury immediately evaporates when you don't capture it, when the poop comes out. And so, yes, it does work beautifully. And then here's two studies just from the, oops, I knocked off the literature side here. This is a wonderful, Shiro Nakano is a wonderful Japanese researcher, and he basically showed that when we look at the content of petrochemicals and pesticides and all these things in the umbilical cord after birth, when we pre-medicate moms before birth with chlorella, giving her a relatively small amount of chlorella has reduced the transfer by over 30%, less toxins transferred. And the same was then repeated with breast milk to look at the concentration of various toxins in the breast milk, and again it was reduced by over 30% the toxin content. And I did some cases with using Accuchem in Texas, the lab, where we could show we can take a mother's breast milk, and it is so toxic that you would have to dispose it on special landfills regarding to EPA rules, you know, with PBDEs. That's a study I was part of. That's also on the environmental working group side. Breast milk today has become very toxic, and we could show that if the mother takes about 60 tablets of chlorella a day, 20 tablets 3 times a day, that's not a lot, that we can completely clean up the toxin transfer in the breast milk. Yeah, and so I think this is an important piece of information, and I don't know how to get that clearer across. Cilantro is big in me. Here's one of the studies that shows that it's fantastic for methylmercury. It's the strongest natural binding agent for methylmercury and elimination agent for methylmercury. It does cross the blood-brain barrier. It works beautiful. It has not been appreciated because it doesn't cost anything. And people, I don't know, you know, in Europe it has become the leading treatment. The research is out that it works. Here it has been underappreciated. I use for detoxing the brain nanonized chlorella. It's called matrix metals from BioPure. We spray it up the nostrils to get it into the brain. The biggest thing lately is melatonin. Melatonin protects against mercury-induced oxidative tissue damage. a lot of papers on how melatonin detoxes the brain. It is in the brain a far more important detox agent than glutathione. When you inject glutathione, it never gets in the brain. It's a too large molecule. You cannot give melatonin sublingually or orally and get it in the brain. It's a peptide hormone that does not cross the blood-brain barrier. The only way we can currently get melatonin up in the brain is by elevating the body's own production. We do that through injecting pineal extracts, by using some of the standard process, glandulars, and by doing sleep. And to do the sleep, the room has to be dark, even if your kids are paranoid or afraid. If they sleep with the night light, they never reach the levels of sleep they need to create enough melatonin to detox the brain. It's a huge issue. But the biggest disturbance to creating melatonin in the sleep is the exposure to electromagnetic fields, and I get into that in a moment. Okay, nanonice, chitosan, apple pectin, there's other things. There's a reed grass from Russia, which is fantastic to detox. Lymph drainage massage is important. The biggest one, unfortunately, is cut off. Here's a whole section on colonics. Colon hydrotherapy is a huge, absolute important tool. If your kid has never had colonics and is still autistic, you're really missing the boat on one of the most profound and most important interventions. So I like to inject DMPS in the kids because it's a one-time intervention. It's done every 2 weeks. They get the standard doses injected, and the next day they have a colonic. There's huge amounts of contaminated poop coming out within the next 24 hours. Ideally, they have 2 colonics, one the next day and one the day afterwards. But if the moms are resistant to the idea, I promise you, the child will not remember this as sexual abuse later on. There's that weird idea ghosting around in the US that comes from your Puritan upbringing. We Europeans are much more easy on shoving things up the rear. And the American society is very orally fixated, to use that Freudian term. And the Europeans, we may be more rectally fixated, anally fixated, and for all it's good and bad. But please use the rectum as a route of entry. We know, for example, DMSA is only 20% absorbed if you give it orally, but if you give it rectally as a suppository, you get 80% absorption. That means you save money on it, by doing it that way. And many of the kids, refuse to take things orally. And you just, as a mom, you're struggling and you just don't know how the hell to get it in there. And the rectal route is something you can work out with the child. You can negotiate with the child to use it as a route of entry for all the nutrients that you need to bring on board. In MS patients, we still use all the vitamins or so are given rectally because they have poor absorption this way. And rectally, we're bypassing the biofilms and all the absorptive barriers that the bugs have created. The third component of the treatment of the microbes is to modulate the immune system. Yeah, we're looking. Most of you have spent years of attending lectures of how to modulate the immune system, the Th1 and Th2 and Th3, and whatever you're using for that, with vitamins and other things. I use autourine therapy. We collect the urine of the child. We draw it up through a micropore filter and inject up to 2 cc's twice a week. And it's fantastic how it resets the immune system, how it balances out Th1 and Th2. Usually it takes about 12 injections to get there. And then we maintain them on once a week, a shot in the bum, works beautiful. The leading underlying remedies for Lyme disease in the children are these 3. Those of you, or 4, who are using the Penicillium notatum, that's Notakil or Pleonot. It's the one that we use for the chronic strep infections in the throat. Forgot one here is the Pseudomonas one that we use for the strep infections in the throat. Most of them have it. And then the Aspergillus niger one is called Pleonic. That is the most nasty mold that we find virtually in all the children. When we use Esoterics. It's a wonderful new mold panel. We never had a kid that didn't test positive for one of the aspergilli, Aspergillus fumigatus, Aspergillus niger, there's a few others. Beautifully treated with this. And then 2 immune stimulants are called Pleolute and Pleolute-S. This is sort of out of years of having struggled with learning the underlying theory. That took 12 years to learn the theory, and then 12 years to manage all the 50 or so medications. And this is left sort of what I use every day. And then the laser field restructuring has become a big thing. Lee Cowden has made his own sort of version of that by using it largely for detox. But we're using it for every medication, vitamin or homeopathic, a child or mother has ever been on. So we found, for example, if the mother has been injected at birth with any of the things that trigger contractions, that those things hugely interfere with the neurotransmitter production in the children. Oh, thank you, thank you. And by giving it homeopathically, the trouble is you have to then kind of look, is it a 4x, a 6x, 12x, LM, which potency do you give? By giving it with a laser, by blasting it into the field, just using the original substance, we very quickly, rapidly, with one treatment, detox that particular thing, and kids improve much more dramatically and quicker with it. Nancy, who just was here, she has a little table out there. We've developed, like years ago, like a little machine that does this movement. You just put the thing in front of it while the kid is sleeping. You don't have to be there. You put it, the treatment is 20 minutes, and the laser waves the frequencies of the particular medication into the field of the child and resets the entire immune system of the child. And then the last one is again the vacuum water with the singlet oxygen energy. The fantastic simple ways of modulating the immune system. I promise most of you have your kid on 40 supplements to do this job. And I promise you this is a lot easier and a lot cheaper. I'm sort of the socialist in the group. I want to say something to that. All the leading research in autism has been paid for by moms that wanted to save their kids. Yeah? All of you have paid, some of you have sold your houses, you've wrecked your finances in order to get your kids well, and the physicians that you're working with have used your kids' research and then publishing their papers, and the whole field is driven forward with your money. And I feel really bad about it. I know how much taxes we're paying, and I know where the money goes that's supposed to go into the research for autism. It's not ending up there. And so and so, I mean, I really, honestly, I feel deeply for you. Many of the treatments I recommended in the past to my kids, I couldn't afford myself. I'm a physician, I'm not a rich physician. I haven't figured that one out yet, how to turn it into a real business. But some of you have been my patients. I use muscle testing as my indicator. I take the research and then translate it into muscle testing, and then at least when you're with me, yes, my office visit may be expensive. I think it's $400 for the hour, but you're only allowed to see me once every 4 months or so, or 4 to 6 months. I put you on a program, and there is no lab testing. There is no extra fees. And the treatments that I recommend, the supplies for autourine therapy for a year cost about $5, and that is where you're paying for, I don't know, $5,000 in a year at least, for your supplements. And so I just want to suggest to you there is other ways of doing this, of skinning the cat by taking the research that's there, but then translating it into more simple action. Okay, now to my talk. I use an old yogic system of philosophy that we don't just have one body, but we really have several invisible bodies that surround our body and penetrate it. The first one is the physical body, and pretty much everything done in our field relates to that. And the second level is the energy body. The energy body is where the forces of physics are expressing themselves. The electromagnetic force, the physiology, the word physiology is the combination of the word physics and biology. And all of you ever hear about at your seminars is the biology component of it, but nobody talks about the physics. So I'm going to give you a little bit on the physics of health. And then there's the higher levels. These are largely the psycho-spiritual levels, and some of you have been with me when I do family constellation work. The family constellation work is a wonderful psycho-spiritual healing work. We work in a group, and the mother chooses from the audience representatives of the significant blood-related ancestors of the child. Yeah, so there is a representative for the child, a representative for the mother of the child, the father, the grandparents, and so forth. And we're looking usually at the effect of ancestral trauma, 2, 3 generations back, 4 generations back. A child died, somebody had a severe disability, somebody was locked up in a psychiatric institution, somebody had to go to war and came back severely traumatized. And we're placing that in a room, and very quickly the representatives start thinking and feeling as if they're a person. And then we do healing work with that, and we believe that the healing impulse is broadcast back not only to the child that we're working with, but also to the parents. So it's the only psychological work you can truly do for these children, and the results are absolutely astounding. It is, kids that were sort of flatlining on their treatment for 3, 4 years have now, over the next year, a steep increase in their health and the responsiveness to the treatments that we're giving. It's called systemic family constellation work. And so what I will focus on now, the rest of my lecture, is the second level. So let me go, this is a little bit on the first level, I'm going to jump. This is tubulin, very, very important. Tubulin is a molecule that is in all our tissues, but especially dense. This is a nervous system cell. And tubulin, along the tubulin is the transport of the neurotransmitters, but there's a lot more to tubulin. And tubulin is the first molecule destroyed by mercury. Here's mercury vapor coming off a 50-year-old dental amalgam filling. And of course, the main source of mercury in our children is the amalgam from the mother. It's not the thimerosal. Thimerosal is the second hit that they're getting. And nobody talks anymore about the amalgam fillings. It's become a dangerous thing to talk about, and so I take that upon me. There is a direct correlation to the rates of autism and the number of amalgam fillings the mother has. I'm just going to jump. This is an important study that some of you may be aware of. A wonderful physician from Mexico. She asked little girls and little boys to draw a person or to draw themselves. This is in areas outside Mexico City where there was very little pesticide exposure. This is the typical drawing of a 4-year-old girl from an area closer to the city where the amount of insecticides, pesticides, petrochemicals found in the body of the children is higher. The same with boys. Why 5-year-old boys and 4-year-old girls? The trouble with boys now is they have testosterone. Testosterone has a devastating synergistic effect with most environmental toxins, not just with mercury. And so we guys belong to a dying race. And we know that the reason why the ratio autism boys to girls is 4:1 is testosterone. And so this picture has touched me more than many other things, because in one picture you see where the problem is. Right? You don't need to have a long lecture. Is there really a problem or not? Yes, there is a big problem. And you can see it, make it visual like this. The genetic testing, I'm not going to go over this. Here's a wonderful picture of the white blood cell being attacked by the Lyme spirochetes. And I promise you, this white blood cell is not putting out any antibodies against Lyme disease. It cannot. And this is the reason why the Western blot test will be negative unless you knock back the spirochetes first with a good treatment and then do the Western blot test. This is why other people, other than Amy, me, and like a handful of other physicians know that most autistic kids have Lyme disease, because if you do the test straight off the bat, even when they come in your office, you won't find it. You first have to treat it, and then you can make the diagnosis. It's one of the paradoxes in our modern medicine that we have not developed simple lab work in fact, in my state, I'm not allowed to have a microscope in the office. You know, all of modern medicine is based on microscopy and bacteriology and stuff. We are not allowed to have a microscope in the office. It's illegal. Where have we gone? I mean, can you imagine this? Quo vadis? It's incredible. Different types of Lyme tests. Now here a little bit on the literature. Lyme in the nervous system can mimic, and I'm just highlight a few things, encephalopathy, which of course all our kids have, can have these elements, encephalitis, which of course we believe most of the kids have in a low degree, dementia, looking like things, and here comes the big one. Fetal borreliosis can cause fetal death, growth retardation, cardiac anomalies, hydrocephalus blindness, neonatal respiratory distress, SIDS, and toxemic pregnancy. So this is 1989. They knew that already, that there is such a thing. We know that there is complete placental transfer of spirochetes. Don't respect the placental barrier. That means if mom has spirochetes, so does a kid. 80% of the population does not know they have Lyme disease. The mom may have a little bit of fatigue as her only symptom, or a little bit of brain fog, and feel a lot better during pregnancy. Yeah, because of the hormonal changes are stabilizing her nerves. But it's unfortunate that most moms do not know they have Lyme disease, and I do believe before every pregnancy, mom should take a month of Rizoles, which is a wonderful treatment, no side effects, and then do the Western blot test. And then it will be positive, and then she knows she has to protect herself during the pregnancy. By the way, I do currently hold that the only treatment during pregnancy that is safe is, that is supported by the literature and by enough people, is to put moms on antibiotics during the pregnancy, amoxicillin or ampicillin at a fairly high dose. I don't believe you have to do it every day. You know, the 1,000 milligrams 4 times a day, it's a high dose. It's a big whopper, but I think a week on, and then a week a lower dose, and a week a higher dose, and a week a lower dose is a good schedule. Unfortunately, the Rizoles, many of them contain plant oils that are, like artemisinin, is contraindicated in the pregnancy and so forth. So I do think we need to make the diagnosis before moms get pregnant. It's a crime that we don't do that. So it's a Western society that is not catching up with the fact that we need to test moms and dads before they get pregnant. It's a stupid society that is doomed for extinction. I mean, there's no question. You know, where the strictest standards are right now for where the homes are checked when moms are pregnant, where the home is evaluated for mold and electrosmog. There's only one country that does it. There used to be 2 countries. Now it's 1 country left. It's Iran. It's the only country that protects the moms ruthlessly during the pregnancy to create healthy children, with one goal in mind, of course. They figured, well, if the rest of the world is committing suicide and we're not, it's a simple way of winning the game. You know, we're being stupid. I mean, as a society, we're being absolutely irresponsible and stupid. So, I'm not going to go in. This is the Vacuum singlet oxygen machine from Sweden. That's really wonderful. A little bit about the global warming. We know that the global warming is certainly driving the growth of insects. Yeah? We know that that insects are benefiting from the current environmental changes, and the global warming plays a big part in that. Okay, energy medicine. I'm going to go quickly now to a couple of things. Yeah, here John Welsh, who I met last week, "Is Autism Due to Brain Synchronization?" is the title of his publication. The involved neurons lose the ability to become electrically synchronized and to generate coherent rhythmic output. I developed an instrument based on the Rife technology, where we've known for a long time when you use the Rife treatments and the correct frequencies, that kids benefit. And I have some comforting words for you. It probably does not matter what frequencies you use. It's probably just simply giving the brain a pulse that it can follow. It's called entrainment. The brain has that habit of following frequencies and giving to it. But I realized that these fields don't have to be the ghetto blaster type frequencies that come off the Rife machines, but they can be gentle and they can be biological. This instrument uses frequencies that are shaped like an EEG, they're biological waveforms, and it behaves very differently. It's fantastic to use this with the kids. Nancy has that instrument. She kind of markets that instrument. I put all the frequencies in there that were in the literature that are called microbial inhibition frequencies, but always giving the brain a pulse with that it can follow, somewhere between 2 and 12 hertz. Let me maybe jump forward. If you have a cordless phone at home, cordless phones create a pulse between 10 and 50 hertz that is devastatingly strong. And so when you have a cordless phone in the home for 24 hours, the brain of your child cannot go in a deep healing state where it can produce melatonin, which is somewhere in the range between 4 and 8 hertz. It cannot do that because you're driving the brain of the child. When you have a cordless phone, wherever you have reception in your house, you have the thing in the kitchen with the little antenna, wherever you walk in the house, you have this 15 or 20 hertz pulse that is driving the brain waves of the child. The child will respond to that by being at this fast rhythm where all the healing functions are switched off. So it's the first thing that comes out of this. We do tapping of acupuncture points. This is a little about the biophoton field. Here, the study that I was part of, I'm sticking 2 acupuncture needles in the stomach meridian on this side of the body, and you see the stomach meridian lighting up on the other side of the body. I have a lot of stuff like that, and I only got a few minutes left. Biophoton field is the first level of the field around us that looks something like this for people that can see it. Okay, now I'm just going to scroll forward. Okay, electrobiology and autism. This is the most important part of my talk, and I'm going to get through this in a few minutes. Body voltage in the sleeping location of the pregnant mom or the infant after birth. Body voltage is measured with a simple Radio Shack instrument. I have that set up here. You're holding an electrode, and the instrument measures how much voltage my body stores against the ground. This instrument is plugged into the ground of the electric system, and right now here my level is somewhere around 550 millivolts. The body functions, the neurons in the brain function at a level between 40 and 80 millivolts to 120 millivolts max. The body voltage increases from the body surface where I'm measuring to the inside. It means on the inside it's much higher. Neurons cannot function when my body voltage is higher than 40 millivolts. It cannot. Here my body voltage is 550 to 600, it oscillates. That means if I would be sleeping here as a grown-up, I couldn't sleep. If I would sleep here as a child, as an autistic child, there would be no possibility for me to responding to biomedical treatment. It would not be possible. For $20, you can measure this. Nancy has the instruction how to do this. It's very simple. It's the most important measurement. I take you through this now. The body acts like an antenna for ambient electric fields in the home and builds up electrical tension against the ground, which interferes with numerous biological and physiological functions. Body voltage increases towards the center of the body. Okay. Reported damage caused by EMF includes damage to the developing neuronal networks, to cell signaling mechanisms, the epigenome, the cell membrane, and interruption or stimulation of cell signaling molecules, and damage to the DNA itself. This is sort of all in the literature, what this is doing to me. This is just from the wires on the wall here and the lamps and the computer here. Now, I did an experiment on this. I wanted to know, is this really true? How about autism? Okay, and let me give you quickly what we did. So we measured mother's body voltage in the location where she was pregnant with the child. Often, mom today is not sleeping anymore where she was when the child was conceived. Yeah, so we went back to the homes, sometimes a different house, and asked the new owners if he could measure where mom was sleeping. And then we're measuring the child's body voltage in the current sleeping locations. So we tested the homes of 10 children with neurological impairment. Some were, I have it down here, so 8 were on the autistic spectrum, 1 child with Rett and 1 child with Asperger's. Median age was 3 years and 8 months, so we took the early ones. And here's the measurements. And then we had 5 healthy children from the same families. When there was like an older or younger child that was healthy or appeared healthy, and a sick one. And we measured the body voltage. So mom's body voltage in the bed at the location of the pregnancy was 1872 millivolts. This is the average of 10 children. And in the healthy group, it was 224. Still bad, but look at that difference. This is the most different of any parameter ever measured in autistic children. And this is the body voltage in the child in the current bed location. It's over 1,000 in the autistic kids and 120 in the healthy siblings in the same home. It's in the same home. This is the biggest difference of any parameter ever measured. And believe me, nobody is giving this any attention. And I'm lecturing to you. I promise you, maybe one of you in the room will do something about it. But it will wipe through your brain because there is no consensus reality yet. There isn't enough of us talking about this. There is not a mental field that is holding this yet. This is the hugest thing in autism that I found in my 33 years of looking at this. Here's a little study. I just gave you what the paper says. Whatever the body voltage is that we're measuring of mom, it is even higher in the fetus. When we have a pregnant woman and we measure mom's sleeping location, and mom may have a body voltage of like 500, it may be 5,000 in the womb of the mom. It concentrates towards the body. And then here, however, within the fetus, the basic restriction is considerably exceeded. There is guidelines given by the EPA how much body voltage should be. And in every pregnant mom tested in the study, it was exceeded. There's nobody guarding moms. There's no government agency that does anything about this. Just like most of you won't do anything about this when you come from the seminar. Okay, the second parameter that we measured is the microwave exposure of the pregnant mom or the infant after birth. Microwave, the instrument is here. The level here is about 1800 microwatts per square meter in this location. Anything over 1 has been shown to cause biological damage to the fetus. This is 1800. If you would be sleeping here and be pregnant here, you would have a child with autism or any other, fetal death or SIDS or any of the other. You would have chromosomal abnormalities. You would have every damage that you ever heard about. So this instrument is measuring cell phone radiation that is just coming in, then the wireless technology in the home, which is catastrophic for the children, and cordless phones. Again, we went and measured in the same homes. So a mom's bed where she was pregnant, the average was 290. In the healthy group, the mom's sleeping location, we had to go to other moms here because these were the same moms that we measured before. So moms that gave birth to healthy children, we measured her microwave density in the sleeping location. It was 12 microwatts per square meter. Look at the difference. I mean, this is the hugest difference. You look at the glutathione levels, and you're kind of happy, if the glutathione is 40% lower in the autistic group. These are percentages of hundreds of percent difference in the 2 different groups. And then this is the child's current bed location, 180 microwatts and 14 microwatts in the healthy group. So this is really what I wanted to say. Maybe just a little bit about the known things that are in the literature. So the electromagnetic fields decrease pineal function with decreased melatonin production. It opens the blood-brain barrier as much as it's there. Brain fog, fatigue, short-term memory loss, these are all things from grown-ups that we know. Here's a simple model that science has given us for the electromagnetic fields. Electromagnetic fields create in the body excess positive charge that creates acidity, it creates free radicals, and it creates disease. This is the cordless phone at home, not the cell phone, but the cordless phone called DECT system. Disturbs all known intrinsic rhythms. Blocks the blood-brain and gut barrier. You know, the leaky gut syndrome can also be explained not just by the Bt toxin, but can also be explained on the basis of electrosmoke. And here is the big one. It has a synergistic effect and increases mold growth and mycotoxin production in homes. And then the last one is the cell phone radiation, again a little bit from the literature, increases cancer rates threefold in 10 years after the cell phone radiation is installed. It was called the NELA study. Delayed and disturbed brain development in infants. How much more need you to hear about this? And nobody, no government country in the world except in Iran is doing something about it. It's shocking to me. And I will have on my literature, on my website, a literature list with over 800 references to this and good biological journals. We are the younger we are, the more vulnerable we are to electromagnetic radiation. This is a cell phone experiment. This is a 5-year-old, 10-year-old, and a grown-up, and this is measuring the decrease in the increase in brain temperature after a 2-minute cell phone call. So in a grown-up, it's a relatively small area in the temporal lobe. In a 5-year-old, this almost the entire brain warms up and heats up. It's just to show that the child's brain is much more vulnerable to these phenomena. Here's sort of my thesis, Autism and the Wireless Age. Is humanity committing collective suicide, or are we just destroying a few generations of children? This is really, I want this to sort of reach your heart a little bit. You know, have you just sacrificed your child and your child's generation, or are we going to keep doing that until there's nobody left? I think she was here, right? And George Carlo was supposed to be here. Was he here also? Yeah, okay. So at least, you know, I'm glad that I'm not alone in the field anymore. There's other troopers, other stormtroopers here that attend to these issues. This is an American study. It's looking directly at the damage when you actually use a cell phone, but I'm using it just to make the point. This is after a 2-hour phone call. It would be the same in your teenage son. This is a healthy red brain, and 50 days after a 2-hour phone call, the red brain looks like this. These are albumin deposits that will never go away, the permanent destruction of certain functions of the brain. Here's some of the 2 best studies that I found. This is looking at the cell phone radiation fields, not using a cell phone, but the fields that we're all exposed to when we're in an area where there's reception. And I just give you the gist of it. You know, so the first step is mediated in the plasma membrane by NADH oxidase, which rapidly generates reactive oxygen species. So this is your oxidative damage that we find in the autistic kids, even though they need oxidation to kill the bugs. But this oxidation is not happening where the bugs are. This is happening in your own body cells are destroyed by it. Yeah, so we have this weird paradox. We need oxidation to kill the bugs, but there's already too much oxidation going on in the cells. And it's a conflict I can't give you a solution for yet, other than doing therapies in tandem rather than all together. A detailed molecular mechanism by which electromagnetic iteration by mobile phone induces the activation of ERK cascade. So the ERK cascade, these are central signaling pathways that are interrupted. The kinases, this is transcription and protein stability. This is the way the DNA is read. The DNA information is translated into making these enzymes into the proteome, and how the enzymes are then activated to create the things that they're creating. This is all interrupted with the cell phone. This is exactly where researchers are looking. Oh, yeah, we find all these problems in autistic kids. We wonder what's causing that. And on the other hand, there's already studies out that show what's causing it. We already have a simple mechanism of how to diagnose it. We have a simple treatment, which I'll show you in a moment. But it hasn't clicked yet that this is important. It has not clicked yet. Here's another study, very similar. Mobile phone radiation activates a variety of cellular signal transduction pathways, amongst them the HSP27 blah 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 is again another kinase. It's a stress response pathway. It alters the blood-brain permeability and leads to possible accumulation of brain tissue damage. When you read this study, it explains everything we know about autism. We don't have to go always to the biochemistry. This is pure physics that's destroying these kids. Here's this this is the distance from a cell phone panel, from a cell phone tower. There's all the medical illnesses, leading ones being fatigue and insomnia are the two leading. So if your kid can't sleep, most likely it's the electromagnetic field. And I'll give you the solution here with the finish. So how do we diagnose it? We use appropriate electronic instrument. Radioesthesia hasn't worked for us. We tested the different dowsers or so. It's 2 out of 100 that get it right. And you don't know who you're working with. This is the little instrument here that I use for the cell phone radiation. Okay, now here's my 2-step electromagnetic field solution for the autistic child. Number 1, switch off all fuses at bedtime. The body voltage that I measured here with this one, that was the first test here, that should be under 40. When you switch off all the fuses, it will be under 40. You can get somebody in your home to measure it if you find somebody, a building biologist. Most of them don't know. Most people that advertise their services don't know how to do body voltage. Yeah? So the safest is you switch off the fuses at night, you buy a few flashlights. That's a $10 solution to a huge problem for the autistic child. The second one is more expensive. Create a Faraday cage around the bed. The results, instant improvement of sleep and mood, other neurological improvements, and increased responses to biomedical and neurosensory treatment modalities may take a few months, but are very dramatic. When the moms do this, it is absolutely phenomenal how the kids start healing again. And here's the Faraday cage. This is a bed, and this is a silver-coated cloth. And at night this comes down, and it creates a complete shield against the incoming cell phone radiation. It reduces it to 1/10,000th of the field strength that was there before. And under this sleep sanctuary, the kids start recovering. It is very, very dramatic. A little bit on the literature, 5 levels of healing. So this was the first 2 levels. There is other levels behind it. I'm not going to go there. Let me sort of summarize a few things. So what I'm proposing as a treatment or as a overall philosophy to autism, that there's a synergistic effect between environmental toxins that accumulate in the body and the secondary growth of microbes in the body. And this growth of microbes is fueled in the body by the exposure to electromagnetic fields. Electromagnetic fields, the exposure, if I take a milliliter of air right now, the concentration of radiation density in here compared to 10 years ago is 8 million times higher today than it was 10 years ago. It is the only, remember I started with this growth curve of autism, it is the only curve of increase of environmental insult that is exactly paralleling the curve of autism. And I'm proposing epidemiologically that is probably the most important single factor. And so this is the cause of autism. To treat autism, you have to do all the things you've been doing. But please include protecting your child from electromagnetic fields. That's the only thing I want you to take home as a take-home message. Nancy, is Nancy still here? Nancy's back there. She can let you know where you can buy the Faraday cage, the shield. It's a special cloth that we have made that is silver-coated. It is true silver, and it is not cheap. Unfortunately, with the current global crisis, the silver prices has also gone up astronomically, but it is still doable. I promise you, if you stop biomedical treatment for 2 months and buy the net, you have the same cost, and you're going to get a lot more mileage out of it. So I hope that was a bit helpful to you. Maybe some small new ideas. Other than that, I feel for you guys, for you moms that have autistic kids. I'm an ancient person, but I have 2 very young kids, a 2-year-old and a 4-year-old. And I'm going through hell trying to raise 2 normal kids. It is absolute torture to me. And honestly, my heart goes out to any of you moms, who have kids that are neurodevelopmentally ill and need help. I don't know how you're doing it, but I take my hat off to you, and I hope I can make a little tiny contribution to it. So thank you.